Welcome to Medicine in Small Doses with Dr. Amobi. I'm Uju, and today's episode is the fourth installment of our Erectile Dysfunction series in honour of men's health. So if you've listened to the first 3 episodes, you're going to know that in the first episode we covered the top 5 ways that men have presented in Dr. Amobi's clinic with erectile dysfunction. In part 2, we had the perspective of a wife who has a husband with suspected erectile dysfunction. In part 3, we met Ikenna, our infamous erectile dysfunction patient, and now we're going to follow up with his case. Now we're in Dr. Amobi's head once again. What happens next in this case scenario? Welcome back, Doctor.
No worries. Thank you. Right. So in this case, it will be for me to establish, the timeline of his symptoms, whether it's something that is a gradual onset or whether it's something that of a sudden onset, for example.
Right. When you say timeline, as a woman, as a female, when we go to the doctor about anything, we always get asked the same question: when was the date of your last period? It's very specific. Obviously, to make the assessment, they want that timeline.
Yeah.
Going for a headache, when was your last day of your period? Or first day of your last period? It's like, So in this case, is it the same for this kind of examination, or do you need to know? Yeah, consultation.
Yeah, because I would ask him, like, how long do you think this has been going on? Mm-hmm. Right? It's because most, the wife said, it's been going on for a year. Yeah, right? So you need to establish. So from what she told me already, that 1 year has already given me an indication that it's something that's gradually, been going on, but I need to confirm from him, right? So, and the utility of the use or the usefulness of that question is, if it's something that's gradual,
right,
it gives me an idea that maybe there's a disease state that is going on, maybe there's a medical issue that is causing it, and then within that, I would want to know, how long this has been going on. Is he still getting normal erection just like every regular man? So what that means is men get an average about 11 erections a day. Right. And they get like a full erection about 5 to 6 times while they're asleep. Okay. So those are things for me to establish from him as well. Right. And another thing is this, is he still having the thoughts, even though that he's not getting erection enough to facilitate that? Is he still getting an erection? Right. So those will help me distinguish between what we call psychogenic cause, like things like psychological causes, right? Psychological causes to me would be somebody who is like a sudden onset, right? So all of a sudden it just happened they have a drop in their libido. So the thought about having sex is not there. But when they are, I don't know how to say this a bit more delicately, when they are by themselves, they're able to get an erection, right? Fine. So when they're watching like explicit images, they wouldn't have any issues getting an erection, right? So they will be able to rub one off, in good spirit, with no issues. So that would distinguish between more psychological and physical cause. That makes sense.
Okay, yes and no, because I'm just obviously as a female. So basically, if it is caused by psychological issues,
So psychological issues can be, for example, if there's any anxieties, there's any depression, wife is telling me that everything is going well at home. Is he like, is he unhappy?
Right. Okay. So something that's triggered it.
Yeah, exactly.
And it's quite, it's able to be pinpointed.
Exactly.
As opposed to
physical causes like 1 or type 2 diabetes, because it's a blood vessel disease. Are we dealing with high cholesterol? Is he a smoker? Is he overweight? Is he obese? Has he had any previous surgeries before? Is there any other diseases that he has that is going on that we need to figure out in the first instance? So all of those things are things that will give you a bit more information on how to deal with his concerns.
Brilliant. Okay. So what happens next after that then?
So after you establish, rule out other potential medical or psychological causes, and of course, social causes. I think I don't know if I mentioned earlier that in my experience, most people who have like physical causes will end up having psychological causes, may end up having some social causes. They always interrelate with each other. So from examination perspective, important things is we need to check your blood pressure. We need to measure your body mass index. So we check your weight, your height. We actually do what we call waist measurements. So where we use a tape and see whether your waist measurement shows that you're overweight as well. We will check to see whether your body is having a bit too much female hormones. Whether the man has breasts, whether he's not as hairy as you would have expected him to be. So all of those things may actually show people who got testosterone, low level of testosterone, let's say. So, and then you, of course, examine his penile area to make sure there's no disease of the penis, and you need to make sure there's no testicular swellings and things like that. If you suspect that there may be prostate-related issue, then you may have to do a rectal examination to make sure the prostate is working as well. Then once you finish doing all of that, then the next move is going to be to run some blood tests. So, of course, the blood test now is, again, you need to rule out diabetes, you need to rule out cholesterol, you need to check the testosterone level, and do other things like, depending on what your clinical suspicion is, then you may recommend for things like scans, for example. So those are the things that I would expect your GP as a minimum to do for you if you present with erectile dysfunction.
Oh, excellent. Okay. And how about, I think we mentioned the role of maybe his partner or wife. Is that something?
Yeah, I think that's actually a smart thing. Normally in my clinical practice, especially in my private clinic, whenever a man comes to me with erectile dysfunction, I always urge them to bring their wives or their partners, because there are certain things men may forget, the woman will pick up.
Right.
And also, it gives the woman an opportunity to ask questions. Also, it makes the women appreciate their partners a lot more. So I have seen some instances where, out of frustration, let's say, wives or partners, label them like, having a small p energy. When I was giving a talk a while ago, this guy said, a girlfriend sent him a text message that he had the audacity with his soft P to go and cheat. When, of course, that wasn't the case, according to him, I have instances as well when men would, reflect that their partners would say you can't be angry and have ED at the same time. People would, say, you can't be impotent and arrogant at the same time. So when you hear some of these men reflecting all of these, then you actually know that it's perhaps out of frustration from partner. I'm not making excuses for the ladies. Some women have actually gone out and have extramarital affairs as a consequence. So it's not just the frustration between both of them, is the consequence of all of this. Whereas when both of them learn, and I can tell you how many times, if I tell you how many times that women have went, wow, I didn't know that this is what happened. So this is a consequence of this. So there's a great utility in having both partners being there present, and I do the same thing in my menopause clinic as well. So when women are going through low libido, I bring their partners and educate them about how menopause can cause, low libido, low sexual desires, so, and it can affect their mood and in memory and things like that. So every one of us would have a point in time where we're going to have to lean on the other. So that's the importance and significance of having your partner in this journey as well, if that makes sense.
It makes a lot of sense. Thank you.
Yeah.
The next question I want to ask is erectile dysfunction, is it reversible?
I think that's a very good question. So, every patient is an individual and you treat them as such. Mm-hmm. If someone comes in and have low testosterone, for example, if you give them testosterone replacement, you will reverse the condition. If it's something a bit more long-term, then there's a lot of long-term approach that you can take that will improve their symptoms as well. So it depends on the actual individual patient, let's say.
Mm-hmm. Okay, for men who are wondering, I haven't been diagnosed with erectile dysfunction. I may not have it, but I definitely want to know how I can avoid becoming another statistic. How do you reduce the risk?
Yeah. So in my coaching program, whenever I see men, and I do get this question a lot, so it's all about the principles of lifestyle medicine that I incorporate in almost everything that I do. Mm-hmm. Number one is, of course, making sure you're having maintaining a healthy, balanced diet. It goes without saying, because a balanced and nutritious diet is vital for your overall health. Then, so if you have when we talked about organic causes, we talked about hypertension, mm-hmm. obesity, smoking. If you reduce some of those or stop those behaviors, let's say, or reverse obesity or reverse high blood pressure, then you reduce the risk of having erectile dysfunction. So, and many other, features in terms of exercise, having a good relationship with your partner, managing your stress properly, maintaining a healthy weight, limiting alcohol and smoking. So all of this good stuff that we talked about earlier. I think people need to listen to our lifestyle one, because I think we covered quite a lot of lifestyle modifications. How they can improve
the overall health. So really, it just comes down again to lifestyle. Mm-hmm. Very simple concept, but just so many people not finding the time to make it part of their everyday life.
Yeah.
But it can and does help with these diseases.
Certainly.
And in terms of long-term treatment, for those that have been diagnosed, Ikenna, for example, what would the long-term plan? Okay. The bloods have come back. He's back now in your clinic with trauma. What would be the follow-up?
Okay. So in this instance, because most of the things that has been happening in their relationship here is lack of communication, mm-hmm. right? She's frustrated more than she's letting out. He knows that she's frustrated and he's not corresponding back. So it's actually, getting them back together, so to speak, to be able to talk to each other, right? And also refer them or recommend for them to speak with a therapist, because you can see the duration this has been going on, the relationship has fractured. Even if you give him a high dose Viagra right now, it's not going to just turn around and change everything, because
it's not the magic pill.
I will come to that in a sec, but so get a conversation. I think by the time both of them, particularly, I think one of the things you can see is that Chioma didn't know exactly what is going on.
Right.
Now, for her to learn some of these things can manifest in two ways. Either she even get more angry that he knew that he's been having erectile dysfunction, that's why he's running away and not communicating. So she probably start thinking that he doesn't trust her enough to have a chat, right? Mm-hmm. Or she may become sympathetic to say, hey, you've been suffering in silence, let's make this work. So that's where therapy has become significant, and then, so there is something you can actually do right away, which is where things like Viagra comes into play. Mm-hmm. So what I would typically do in this type of instances is, let's say, both of them are open to, particularly him is open to Viagra. Right. The good thing about Viagra is it's been on the market the longest. It's the most well-known. It mm-hmm. works in about 70% of men who take it. Mm-hmm. And it's usually start working within 15 minutes or earlier of taking it, right? And it peaks in your blood between half an hour to 2 hours. So so men usually find it quite useful. It can last up to 6 weeks though. Up to 6 hours.
Right.
Yeah, it would be
That
great.
would be the worst.
Yeah, it would have been great if it lasted 6 weeks. Yeah, so it can last up to 6 hours. Now, one of the other things, but one of the problems with the Viagra is that you have to know that you're going to have sex to be able to take it, right? And you have to have the thoughts about having sex for it to work. Otherwise, you might as well chewing gum. It wouldn't make any difference, right? And you have to be prepared. You have to know that your partner is in the mood too. Again, otherwise it will be pointless. So one of the other things that some people find useful is what we call Cialis Daily. You don't typically get this in your National Health Service or straight from your regular GP. We tend to prescribe this one privately. So it's like a once a day tablet that people would take. It's usually useful for people who have sex more than 3 times a week. It takes about 3 to 5 days to build up in their system. So they take it like as if they're taking a contraceptive pill every day. So they're good to go whenever you wake him up at 1 a.m., he's ready to go, right? So that's the utility of that. The one that you normally get from your regular doctor would be the regular Cialis. The regular Cialis works like Viagra, but the difference is that it can work up to 36 hours. So we usually give it to people who are going away for weekend, and then it works for them like that too. So in the short term, they can actually use this to build a bridge until we figure out, even before the blood test even comes back, they would have, got into the groove, if it works for them.
Excellent.
Yeah.
Okay. Is there anything else you want to say before you conclude?
So, I think one of the things that we talked about before was in relation to what sort of like, is there any particular things that you need to eat and things like that. We know that exercising daily for 30 minutes increases your nitric oxide. Eating dark food like berries and grapes, raw greens is pretty good. Kale is fantastic. There's oily fish is very, very good as well. And there are certain foods that you can actually eat to improve your testosterone level. And so, mushrooms are very good. So, and particularly if you're in Africa, please be careful with what type of mushroom that you eat, because some of them can be like the poisonous ones. So make sure you're very careful. We know that food that contains zinc are very, very good. So Nigerian people always, I keep using Nigeria, but African people eat quite a lot of meat. So one lamb shank will give you about 28 milligram of zinc, which is quite useful. Vegetable, any green veggies are good in terms of boosting your testosterone as well. So there's a number of certain things that you can do to improve your testosterone level, to improve your nitric oxide, which normally improves blood flow to your penis, for example. My overall take-home message is, number one, talk to your partner. The case scenario that we use in this case study over the past few weeks has demonstrated that the usefulness of talking to your partner. Go to see your doctor. It's super important. It cannot be understated. And now you've learned what to expect from your doctor. You would expect certain questions. So prime yourself. If I was you going to your doctor, number one is I would sit back, write these things down, because sometimes you may forget certain things when you get to the doctors. Write down how long this has been going on. Write down what you notice. Do you still wake up in the morning with an erection? Those are important things to note down. Ask your partner as well.
Thank you so much, Doctor. It's been a great episode and an enlightening series. For those of you who are struggling with erectile dysfunction, Dr. Amobi does run a 6-week program on this course where he delves into erectile dysfunction on a much more deeper level, offering you the support and confidence you need to manage your symptoms and obviously get through this challenging time. If this is something that interests you, please reach out to us. And otherwise, we look forward to having you on the next episode. Thank you for listening. For all our listeners out there who want to connect with Dr. Amobi, the best way to do that is on LinkedIn at Dr. Amobi. You know, Dr. Amobi is the Chief Medical Officer of 3 clinics. To find out more about the services he provides and how they can help you, please contact him through his team via the following websites: passporthealthuk.com, mymenopausegp.com, and the lifestylewellnessclinic.com. You can also follow Medicine in Small Doses on Instagram at Medicine in Small Doses. We look forward to you joining us on future episodes, and I want to thank you personally for listening.